Okay, so I got the go ahead from Mariah. So let's go ahead and get started. Welcome, everyone. So today we're going to be talking about, as you can see here on the screen, about employee focused career pathways. And specifically, we're going to be looking at the mental health workforce. So let's go ahead and get started. As with any webinar, I know we've all been online for years now, but there's always, we just like to go over the general housekeeping items. So the session is being recorded, and the recording and the slides are going to be sent to all of you who are here and all of the registrants. So everybody will have all of the information we're presenting. Feel free to use the chat box to ask questions, share comments, share your thoughts. I really welcome questions throughout the presentation. So please go ahead if, and sometimes it's good to just sort of pop in and ask a question during that time. I will, stop for a moment. I will look at the chat and then respond to the question. If you are having technical difficulties while you're on, please go ahead and message Mariah Blake. She is, our go-to tech person, and she will be able to help you. We do have an evaluation at the end of the session. Please fill it out. Not only is it a requirement for what we do, but also it really helps us, bring you the type of trainings that you're looking for, and just, always improve. And we just like to say this in general for all of the webinars, please be as present as possible, listen deliberately, and share generously. So just some, high level things. So I'm sure I saw in the with the participants, we definitely have people who have been to our trainings before, but just for those who haven't, we are the Association of Clinicians for the Underserved. So we were started a little bit over 25 years ago by National Health Service Corps alumni. So that's still very much at the foundation of what we do. But as you can see here, it's really offering that support to clinicians, to ensure access to care and support their recruitment, their retention, all of those different needs. But we have a lot of different programming at ACU. So everything from our justice, equity, diversity, and inclusion programs, suicide safer care, vision services, a lot of workforce and well-being programs, National Health Service Corps. But the program that brings us here today is the STAR Center. So we're one of the 22 national training and technical assistant partners. And what I really want to point out with this slide is all of our training, all of our technical assistance, our resources are all free to use. We have our own separate website just to ensure that all of the resources on there can be accessed free without any cost. You can also contact us at this email. That goes directly to me, and then I filter it out to the rest of the team as appropriate. And then this is the wonderful STAR Center team. So I'm going to be the one who is going to be presenting today. So my name is Michelle Fernandez Gabilondo, but we also have Suzanne Spear, who's the VP of Workforce Development. And on the call today, we have Mariah Blake, Associate Director of Operations and Compliance, and Helen Ravenier, Associate Director of Workforce Development. Just wanted to call that out because they were recently promoted to these roles. Very, very well deserved. Also, as we're talking about the mental health workforce, my background is actually in social work. So I also like to bring in some of my experiences when I was doing more of that clinical focused work. And then also just from a lot of friends that are social workers, that are clinicians, currently working in health centers, getting their feedback around what they need is so important and so helpful. So what are we going to be learning today? What are we going to be talking about? Well, as you know, the importance of developing career pathways as part of your health center or your organization's retention plan. And obviously, we're going to look at it from the lens of the mental health workforce, but what you'll see is a lot of the stuff we talk about can also be implemented into the different departments at your health center or your organization. It's important to understand, and this is actually what we're going to start with today, is what are the different types of mental health providers? It's incredibly important for the mental health providers and their staff in your organization that they really feel understood and supported. And one of the ways to do that is to really understand where they're coming from, what is their training, and what are they doing. And then we're just going to look at, what are some opportunities for career advancement that go beyond the mental health department. So we'll get a little bit more into that and how that can support retention of the mental health workforce. But before we do all of that, I'm sure all of you are also familiar with Mentimeter. So what I'm hoping is you could go to menti.com. You can also put up your phone, use this QR code, and that is the code to put in. So menti.com, and then you would put in 56, 90, 30, and 5. And we're just going to ask a simple question. Later on in the presentation, there's going to be a second Mentimeter question. So if you just want to leave that up on your computer, it'll easily automatically upload for you. And I believe Helen or Mariah are going to put the link as well in the chat. So I am just really quickly going to go over to our Mentimeter. And Helen, thank you for putting that. So please excuse. Oh,
Justin, FYI, I think it might be the permissions on Zoom. I can only send it to you and Mariah. So I don't know, Mariah, if you can send it to everyone. But
yeah, sorry about that.
It's okay, technology.
Yes, and I'm noticing those are the same permissions for me. So thank you, Mariah, for sending that over. If for the people who are in attendance today, if you notice, when you want to send questions or comments, if you're only seeing host and panelists, go ahead and still send it there because I'll be able to see it and I can pull the question and I'll read it out loud so everybody else knows what you're asking. So you're going to see kind of the back end right now. So just give me 1 second. Okay, so a lot of you have already answered, but does your health center or organization have established career pathways for its mental health workforce? And you should be able to see the Mentimeter screen. Helen or Mariah, do you mind just letting me know if people can see this or you can see it?
I can see it.
Okay, great. So let's see. We've just had a few people respond. So pretty much across the board, like there's no official yes, there's no official no, but I see nothing formal. Some people are working on developing career pathways and then others are not sure. So this is great. Thank you for responding. And as we get into it, you'll see why career pathways are so fundamentally important to retaining your mental health workforce. So I'm going to go back to the PowerPoint presentation and let's go ahead and get started. So, and I see there's something in the chat. Perfect. So now I believe Mariah let us know that you should be able to also message everyone. So you could send your questions to everyone or send it directly to us. And like I said, I'll make sure to read them out loud. So if you've attended pretty much almost any STAR Center training, you've seen this slide. And I'm not going to go through all of it, but really what it's just trying to get across is that, workforce is essential to your health center, to your organization. You don't have a health center, you don't have an organization without your workforce. So it's incredibly important that you really are investing and prioritizing what it means to have a satisfied workforce, an engaged workforce. And one of those ways, again, with what we're focusing on here, is building career pathways. But as with any organization, we have these key core components of what makes a high functioning health center. So as we're going through today, all these 8 all work together, but I would say we're really looking more at those tested recruitment and retention strategies. And then also just the health professions, training programs, those type of things. Again, how do we work to build pathways for people? And then for anybody who is from a health center who's on, as you work on developing these pathways, as you work on developing these retention strategies, put them down in your comprehensive workforce plan. It's so important to write it down and to have it somewhere, which would be your comprehensive workforce plan. So that was really, I feel like, really key areas that are very important to BIPIC and to HRSA, so the Bureau of Primary Health Care. So, I didn't want to miss the opportunity to talk about our comprehensive workforce plan. So at the STAR Center, we talk about different steps for recruitment and then key areas in retention planning. And as you can see here, there's a lot of different areas listed. Well, there's 5 of them, but we have mission, compensation, benefits, work schedule, and then career paths. So that is where we're going to focus our time today. Now, the final slide in the presentation, because as I was going through and creating this, I thought it was important to just talk about other key retention things that you can do for the mental health workforce, but the bulk of it is really going to be that skill building, and building the career paths. So as I mentioned, when we talk about this, we need to also understand like who are our mental health providers. What is their training? What are the skills they have? What do they bring to your health center? And I think a lot of times when we think of mental health providers, and rightfully so, because that's exactly what they do, we think almost exclusively around, someone who's a counselor or a therapist, or only offering those type of services. We may also look at people who are caseworkers, but they're able to offer so much more to the organization. And it's very important to understand that part of it. So this is a really simple way of looking at how things are set up and what the patient may have access to. So as you can see here, you have the physical, dental, and vision departments, you have the other community resources, and then you have the mental health department. So people who are exclusively working in the mental health department, you can really say they're divided up in sort of 3 categories: the enabling services, the assessment and psychotherapy, and the medication management. Now, as we go through this presentation later on, one of the things that I'm going to bring up that is really important is that as you're developing those career pathways, you think beyond the mental health department. So you think about, does this individual want to work in a different department at the health center or organization? Does this individual want to move, into C-suite roles that may be more focused on finance or more on IT? So don't put the people in the mental health department in this box that is really either the only skills they're offering or the only thing they want to do for the rest of their career. But these are the key areas. So when we think about enabling services, we talk about peer support specialists, social workers, but usually at the bachelor level. So people who are case managers, for example. When we talk about social workers at the master level, that usually is someone who is going towards licensure, oftentimes a clinical license. So when we say social workers here, we're really looking at those who have a bachelor's of social work. And then community health workers and promotoras or promotores, very important to think about all these people that are offering essential services within the mental health department. Now, as we move towards, and I feel like this bucket more than anything is what we think about when we talk about mental health. When we talk about mental health providers, when we talk about the staff that they work with, this is really the area that most people look at. So assessment and psychotherapy. And here, as you can see, you have a mix of many different types of providers. What's important in understanding is each of these providers have very different training. have different modalities that they use to work with their patients, have different ways of looking at the treatments and what they feel may be best for the patients or the client they're working with. So you really need to understand when you're bringing into your health center anybody in these different roles, what are they really trained in? What modalities do they want to work in? What populations have they had experience with? Because coming from a social work perspective, we're very highly trained to work with specific populations. So part of my degree was working with military and veterans who had experienced military sexual trauma. So I had very, very specific training in that area. So it's really important to know, more of the general skills that they have, but what does their training really mean and how do they then fit into the entire health center landscape? And then finally, we have the medication management. So here, it could be the primary care physician, psychiatrists, or psychiatric nurse practitioners. Really important to list the primary care physicians here, because another point that we're trying to make with these career pathways, again, is that the people who are working in the mental health department may not always want to stay there. And they should be integrated into the entire health center. When you have primary care physicians doing the medication management, let's say for someone who is struggling with depression, it's really important that you have a team-based type of care. And that is a huge retention tool for mental health providers, to not feel that they're sort of siloed and treated differently because they're in this mental health department and they can't really be incorporated into the rest of the organization. And actually we did a similar training to this, and I wanted to give full credit to Community Health Center, Inc. They are another national training and technical assistance partner that we work with. So when they did this presentation, they had this really great route of the typical way that mental health providers get to where they get in a health center or any type of healthcare organization. And I thought it was really important to point this out, because along this continuum is where you'll be planning and structuring these pathways. So obviously, starting out as a student or a resident, depending again on the type of training. A psychiatrist, you'd be doing residency. Social work student, you'd be doing your field placement. And even understanding the difference in that language will show your mental health providers you understand what they do and how they do it and how they got to where they are. So after the training, many go into that non-licensed independent practitioner. This is where you have to have supervision and things like that, eventually to become a licensed independent practitioner. And those licenses can be named very differently depending on the state and the type of mental health provider. They just have different titles for the licensing, but at the end of the day, it's sort of, is this person able to offer clinical services to the patients that are in our health center? And if they're not offering clinical services and still working in the mental health department, are they able to offer the enabling services or play other roles? As they continue to grow within the mental health department, one of the important pathways to provide people is the option to become clinical supervisors. I will say my favorite part of, when I was getting started in social work and was already working in the field, was getting to be a supervisor for social work students who were doing their field placement. Many people, and we see this with clinicians across the board, they are really interested in, training the next generation of people who are coming in. So when you're building career pathways, giving people the opportunity to do this is an excellent route to take. Now, one thing that I caution is if you are giving your providers the ability to become supervisors, like clinical supervisor, train students and residents, that you allow time for that. So it shouldn't be something that you're just adding on top of all of the work that they're already doing. It really should be, okay, how do we modify that other work schedule to ensure that they have the time to do this? Because you don't want to build a career pathway that is basically just an add-on to everything they have to do and then burn out your staff. So another route that many people may take is wanting to be that administrative supervisor within the department. So I would probably say a lot of mental health providers, this is sort of, the route that they would go towards, of starting in clinical, doing that for a few years, because it is so difficult and burnout is so high, then wanting to become, for example, like the director of behavioral health, or if there's a chief behavioral health officer or something like that. So building a pathway that goes outside of that clinical space is also incredibly important. And you would be working with each of your providers, each of your staff to, to talk to them, to find the right career pathway for them. Now, this final one is usually one that a lot of people don't consider with mental health providers, and it's that broader agency role. So I have had many friends that I went to school with that have worked in health centers, and many of them have recently either left the field or just left where they were working because they felt that they were very typecasted into solely being, a counselor, a therapist, or only having the option to be the director of behavioral health. And you'll see in a moment in one of the slides, people who are mental health providers have this background, have so many transferable skills to work in leadership positions outside of the behavioral health department, to get other jobs that really would make sense for them. But again, it's critical that as the health center, as the organization, you're building pathways so that they know that these options are available to them, because you don't want to lose someone and then be like, okay, well, we could have kept them if we just considered them for other leadership positions and stuff like that. So you really need to communicate with people about this. So actually in the next few slides, I'm going to talk about some of those transferable skills, but I do want to ask all of you, open up menti.com again. The link is in the chat, and I'm just going to give it a second if you want to use your phone for the QR code or anything like that. But let me go back to what I did before. So just give me 1 second. And now everyone should be able to respond. And I'm just asking, what words would you use to describe a mental health provider or a mental health worker? And again, this is looking at what are those skills, what are those things that we think about when we think about mental health providers. So like, for example, with me, one of them is empathy. That's a huge one. Not only are you trained in it, you need to be able to have that in order to succeed in that role. But again, empathy is a really transferable skill that when you look at leadership, management roles, all of those things, it is very crucially important to do that. So I know we're still waiting for responses, have not gotten any. I am going to give it just a little bit more time. I also tell people, because of my mental health background, I am totally comfortable with silence to wait for people to respond. So yeah, cultural humility, compassion, empathetic. I see empathy throughout supported services, calm, approachable, listeners, compassionate, again, perfect. Oh, and I see Jennifer wrote, yes, if for some reason you can't use Mentimeter, thank you, Jennifer, go ahead and put it in the chat, multifaceted. Yes, I think all of these are, exactly what we think about when we think about mental health providers. Now, in looking at these words, again, these are skills that are very transferable to other types of jobs outside of the mental health department, or really can strengthen someone in their work within as they try to move more into administrative roles within the mental health department. So I think somebody added calm. And the other thing I want you to see when you're thinking about these words is there's also a lot of pressure for mental health providers to always have this, always remain calm, always remain approachable, empathetic, be a good listener, compassionate, and that can have a really big toll on people. And that's why I keep emphasizing this idea of provide pathways outside of the behavioral health department, because if people are completely burnt out with doing that work, they may really excel in some other positions. So what are those transferable skills? Mental health providers, we need to be good at communication, listening, and reflecting. I mean, that is baseline on so much of what we do, especially if you're a therapist or a counselor or anybody offering those type of services. Most of the training, I would say, across the board is very human-centered, very strength-based. You have both clinical and non-clinical training. That's another thing people don't realize. So at least for social work, you really have the decision, do you want to do micro level social work, so clinical, or macro level social work? Where I went to school, and I've heard this from various other schools of social work as well, we not only got clinical training, but we were trained in nonprofit management, financial management, grant writing. There were so many other things that went beyond the clinical setting. We also have strong emotional intelligence, critical thinking, leadership, flexibility, and empathy. Now, when you look at all these things, these are actually key things that any leader in a health center or an organization needs to have. It is so fundamentally important to have somebody in a leadership role that has strong emotional intelligence, that can be strength-based with their staff, that listens, reflects, is flexible. So again, don't put people in this box as only having those clinical skills. In fact, a lot of those more administrative management skills, like I said, the grant writing, the financial management, the nonprofit management, all of those are very similar that you would get in another program, but it's being integrated into the clinical training as well. So all of those things were really to say, when we think about leadership, these are a lot of the key characteristics that a strong leader needs to have. And as you can tell, I think they overlap a lot with those transferable skills. They also overlap a lot with what many of you responded to. So once again, it's, when you're looking for people in leadership roles, when you're looking for people to go into the C-suite, and I'm talking about like CEO, COO, CFO, all of those different things, don't forget about your mental health staff and if they have an interest in moving up to those roles. So one of the key things that you do when you're building the career pathways is you have to talk to your staff, ask them, where do you see yourself in 5 years? Where do you see yourself in 10 years? Where do you want to go? What makes you happy? What do you really dislike about your job? So you're really building something alongside them so that they also have a lot of efficacy in what they are doing and how this is being built out. And this is just another one of, to be an impactful leader, you need to have empathy, humility, and vulnerability. And I will say, mental health providers really know this, because in the therapeutic setting, when you're building trust with your patients, these are fundamental things that you need to be able to bring to the table, and that you can then bring with a team, you can bring to your entire health center. So I did want, before I get more into like the skill building and stuff like that, I wanted to mention, why is this also so important? Why is building pathways both within the mental health department and outside the mental health department so important? Well, it's part of your retention. And when it comes to the mental health workforce, retention is absolutely crucial right now. The people, and not just mental health providers, but here we're going to, of course, focus on mental health providers, are really struggling. And we're finding ourselves in a situation where there is a lot of increased demand, but a decrease in the workforce, and a pretty substantial and rapid decrease. So, as we all know, going through the pandemic, I think brought to light a lot of the mental health struggles that people are facing throughout the world. And I think it also brought to light just how much the mental health workforce is really taking on. And that has only continued to increase for them, seeing more and more patients. So I have everything that's written on here, everything is linked. So like if you want to look at the articles and where these different stats come from, they're all linked at the bottom. And like I said, all of you will have access to these slides. But I feel like the numbers are really important to point out. You know, when you have 48% of mental health workers considering leaving the field because of workforce shortages, that is huge. And that is a huge, huge problem. And what I want to point out here is they're considering leaving the field. They're not just considering leaving their organization to go work somewhere else. They're saying, this is too much, just too much in everything that we do. I don't want to be in healthcare anymore. And if you see people, I follow a lot of clinicians like online and different social media. What has been really interesting is how many of them, you know, that used to talk about, this is what it's like to be a social worker, this is what it's like to be a nurse or a doctor, or whatever it may be, are now going on camera to huge, you know, audiences saying, actually leave healthcare altogether. You know, this is going to destroy you, leave healthcare altogether. And the wording is really, really strong. So one of the ways to support your people is obviously build a good organizational culture. And that includes building in career pathways that address the specific needs of your workforce. Because that's another thing. You don't just want to invest in something and it's not something anybody wants to use. So the other statistic that I think is really important and why we're seeing such an increase in this burnout, for every one mental health provider that we have in this country, there's 350 people that need training. So already we're at a huge shortage. And if you have almost half saying, I'm going to leave because of the shortage, it's only going to get progressively more and more difficult. So it is fundamentally important for every organization to build out a retention plan that specifically focuses, you'll have one obviously for your whole organization, but you need one that focuses specifically for your mental health workforce. 68% talk about, or about 1/3 talk about the overburden that they have with administrative work. This, you know, you always have to do case notes, you always have to do all those things, but there are a lot more compliance issues. There's a lot more that people have had to start documenting. And this has been going on for a while, but especially since the pandemic. So how can you, again, as an organization, allow people or build in the time for them to do these administrative tasks so it doesn't feel like an extra burden on them? Or again, these are key things that may make someone say, I no longer want to be a clinician. And if you have those career pathways with other options, you may be able to retain a great worker, you know, unfortunately not as a clinician, but still be able to retain somebody. And then this is huge. 93% of mental health workers have experienced burnout. That is almost 100, as you can see. And with 62% being very severe. And when you have that severe level of burnout, this is where we see not just, you know, mental health struggles, physical struggles, complete disconnect from your work, increase in suicide rates. So what you're doing, again, by building this culture that's focused on the needs of your workforce, is you're offering them the opportunity to really be able to either mitigate these problems or work with you so they can still do what they do and do it well without feeling that level of burden. And these next two slides, I really put them more in here just because I thought these were great images. They were specifically from the Substance Abuse and Mental Health Services Administration, so SAMHSA. I'm not really going to go through them, but I wanted so that everybody, when you got the slides, you would have this. But just sort of seeing high level, when people are burned out, they're going to feel exhausted. They're going to have professional issues. They're going to come up. So as it says here, reduce feelings of accomplishment, productivity, and then depersonalization, which for a mental health provider, that is a really difficult thing to have because you're literally working, directly one-on-one with individuals throughout the entire day. So that's why when you said, what do you think about mental health providers? That question that I asked, even those words that describe them carry a really heavy burden because you feel like, oh, I need to maintain this all the time. And that's just not really realistic. This one too, the same, it was from SAMHSA, and I wanted to put it on here because I think there is a lot of accuracy. I know it's from 2018, but still very similar. Why do people feel burned out and then leave? Unfair treatment at work. It is incredibly important that you integrate your mental health staff into the entire organization. It's also incredibly important that they do not see themselves as sort of this afterthought, like your medical department is kind of like the shining star, and then here's mental health on the side. And that has happened. That has happened many times, especially because mental health, there's a lot of stigma attached to it. It's a little bit more complex in the way that people view it and understand it. There was one organization that somebody had told me about where they did like a lunch for all of their different providers. I think it was like on a monthly basis or something. And they invited all the departments and then stopped inviting the mental health department, but kept like the medical and dental. So you don't want to do those things where the mental health providers feel like, oh, we're really not valued here. Unmanageable workload, people really need help with this. Lack of role clarity. So one of the things too with building career pathways is you're building their skills and you're really giving more clarity around what their role is. Lack of communication and support from their manager. If you're going to have career pathways, that needs to be emphasized, and it's crucial to have communication between the employee and the manager or supervisor. And then unreasonable time pressures. When you're looking at, one provider for 350 people, and then 48% of those are like, I can't take on more of this caseload because so many people have quit. I'm getting ready to quit. We need to think about how can you support your workforce in those moments. So what are these career paths and development, and how can you achieve that? And I just want to check. Okay, perfect. There was nothing in the chat. I just wanted to make sure. So when you're building out career paths or career ladders, there's many different ways to look at it. And this slide, I find it really helpful because, as you can tell, a lot of the argument that I'm making is don't limit your career pathways to solely being within the behavioral health department. Think outside of that scope because you're going to have a lot of people who feel very burned out, who are ready to leave, but want to take that step into administration, leadership, whatever it may be. So you have career paths, and this is, just different forms of progression. So that's really the way that I'm talking about how to support your mental health workforce. But you also have career ladders, and that's really more of that upward progression. And again, this is why your managers have to communicate with their workforce, because if they don't have that regular dialogue about where do you see your career, where do you want to go, what are your next steps, what are the skills that you need to get there, and how can we support you, you really won't be able to tell, like, is this person really going more in that kind of varied form career path, or they're more interested in the career ladder of just moving up within the behavioral health or mental health department. And there's many key steps as you build these pathways. So, and what you can see here is the key really is that ongoing communication. So building career pathways, and it doesn't have to be something super formal. It could be more informal, but people need to know what are the skills and the competencies that you're looking for as an organization, for that person to be able to take the next step. So again, you have to communicate that with your staff and give them opportunities to build those skills and those competencies. Very similar, determine what is required for each role and the different career stages. Communicate that with your staff. This should be ongoing, regular communication around these topics. And then as a manager, but also as the employee, it's important to identify the training and professional development resources that will help them gain those skills. So really, as an organization, you're working on helping people find this, but you're also listening to them. We're like, hey, I found this training, it may not directly relate to my work in the sense of, something clinical or something to do with therapy, but it's still connected. Like, it's more about different types of communication or conflict management or understanding finances better. Give people the opportunity to do that if that's where they see their career path going. And, I already mentioned the last one, just clearly and consistently communicate that information to your employees. So in the next slide, I'm going to be talking about how do we look at developing the skills of people. So how are you going to be working with your mental health providers and other staff to give them the skills that they need to move into the positions that they want to be in? So, and actually Helen was the one who created this great slide. And there's three ways of thinking about it. And I'm going to start first with upskilling. So that's the one all the way to the left, or sorry, to the right from me. This again, it's that vertical movement. You are kind of similar to that route that people took. Somebody comes in, they're training, they're receiving supervision. Their next step is to get licensed. They're now working as a clinician. And as you're building those skills, they want to learn more therapeutic modalities. So you would give them the opportunity to go to different trainings or things like that. They then want to learn more about administrative tasks, but within the department that they're working in. So that's what it is. It's building those skills for those who want that vertical movement in their career. Now, looking to the left, you have reskilling. And that is when someone, you're looking at it horizontally. They want to still learn different skills, but it may not be completely related to everything that they're doing or necessarily for the outcome of moving up within that position. The one that I prefer, that I think is great, because most people, not most people, many people don't always know exactly where they want to go. I know when they ask me, like, what do you want to do in 5 years or 10 years? I'm like, I'm not sure, because so many things can happen. So cross-skilling is really building in that vertical and horizontal. So giving people the skills that they need. So with mental health providers, their continuing education, their if they want to expand to other therapeutic modalities, if they want to expand to understand and better work with other populations, you're providing that because in their current role, they're able to grow and learn from that. But you're also providing, training on, and I'm trying to think of different things that I've seen, like legal aspects of the healthcare world and how that works. You're training them on, documentation. You're training them on leadership skills, on communication skills. And again, these are strengths they already have, but just like everything, it has to be practiced. So you're really giving them a full scope of different skill development that then would allow them to come to you or whatever pathways you may build and say, hey, this is really where I want to take the next step. And I have the skills now to be able to do that. So that's why it's really important for all of these to work together. So this slide, I think, just reinforces that. You have vertical career pathways, horizontal career pathways. You have to make sure that the training is appropriate, though, for where the person wants to get to. It doesn't have to exactly relate, but there should be some type of connection to why they're doing this skill building and this training. And again, it's to get towards that. What is that ideal pathway that you want to take, and make sure that you have a formal development plan. So as I said, you don't have to have very formal career pathways, especially smaller organizations. There may not just be as many opportunities. So it can be more informal and you can work one-on-one with your provider and your staff. But what you do need to do is have some type of formal plan around this. So it's not that you're just sort of taking pieces as they come along and then figuring out, assessing where are the greatest needs in the health center. How can we develop our people to meet those needs? Again, talking to your people, asking them what they want, building that into your comprehensive workforce plan, building that into your retention plan. All of these things really work together. They don't work in silos. And this slide, I always just like to put in there, it's as you're building career pathways, as you're building professional development, you also need to be very strategic on thinking about, ensuring that you have the representation for underrepresented and diverse groups. Because, when we talk about representation, a lot of places will be like, no, but we're very diverse. But when you look, as you start going up the organization towards leadership, that diversity is not as strong. So, it's important to think about that. If you're developing career pathways, how are you offering continuing education to your providers? And then also things like mentorship, especially for individuals who come from different diverse backgrounds or marginalized backgrounds, that might not be something they always had. So ensuring that you can provide, again, doesn't have to be a formal mentor, but that it's available. Also, experience is just as important as education. Now, I know, for example, if you want to be a licensed clinical social worker, you're going to have to do a master's degree. But thinking about all of the other people that you have in your mental health department, how much education and experience they've all had. And for some people, experience is really their shining light into moving into these other roles. And then similar to what I said, just invest in those career ladders that really support a diverse workforce and that you have, an inclusive group of employees. It's incredibly important for this, for them to be able to achieve leadership positions in however that's represented within your organization and with the individual. And this slide is just, I feel like it's kind of like oh, of course. But again, if you have growth, professional growth, if you have advancement, people are more likely to stay in your organization. Will they be staying in the same role? No, they will be growing, they will be changing. But you have the opportunity to take someone who, it's like, I'm ready to move on. I'm ready to move on from being a therapist, and they can move again into a more administrative role, but you can still give them the opportunity to be a supervisor, like a clinical supervisor for someone who is training at the health center. So you're not losing all that knowledge. You're not losing everything that they provide. In fact, you're really strengthening your health center by building these really broad, like both horizontal, vertical, like, any type of road or pathway for these individuals. And you're taking people who have such important, especially around the emotional intelligence that we really need in the workplace, to have a staff that's engaged, that's happy, that's satisfied. Think about what your mental health providers can really bring to the organization as a whole. And I will tell you that professional growth and advancement are critical. And it's something that when you hire a mental health provider or anybody in that department, you should have that conversation from the get-go while they're onboarding. What are you thinking for long term? What are you thinking for your professional growth? There should not be a delay in this, because it will tell those providers they care. They care about my career, not just me being here for a job. Now, as I mentioned, I wanted to lay out some other strategies for retention, and I want to make sure to leave some time for Q&A, but this is a long list. But what I did was I specifically took the areas that I know are critically important for the mental health workforce so that you can hone in. Again, many of these can impact anybody in the organization. It can impact all of the staff. But if we're thinking about the mental health workforce, like certain things that they look at when they decide, do I want to work here? And do I want to stay working here? These would probably be some of the top areas. So first, equitable compensation. If you've seen me do presentations in the past, this is a huge one for me, making sure people have a living and thriving wage. One of the big things really affecting the mental health workforce is simply the student loans. To get to where you want to get to is incredibly expensive for jobs that don't pay enough to really meet those student loan demands. So ensuring that you have equitable compensation and that you really understand. That's why I started with what are the roles of mental health providers, because really understand what do they do and how much value do they bring to the organization, and have that match up. When I was doing my doctorate in social work, I will still always remember this. I had one professor, and this was in 2019, and he's like, if you're going for a job and as a social worker, every skill that you have, and they offer you less than $90,000, you walk out. Now, that is obviously very, very specific way of looking at it. But the reason that I'm pointing out compensation is because, first of all, equitable compensation is critically important. But knowing your value is a huge part of the education that these providers are receiving. So when they're coming out of school, they're coming out with a lot of training on how to negotiate, how to know your value, what does it really mean to hire me, and how much am I bringing to you, and is the compensation fair for that? So it's really, really important to look at this. Flexible work schedules, another huge one, both the telework, but also part-time options. A lot of, especially the newer people coming out of school, going to work in the mental health field or already have clinical licenses, want only part-time options. A big part of this is they have huge amounts of student loans, and they need to be able to work in another position that really would supplement that income. So they want to work with mission-driven organizations. They want to work, with specific populations, but there's no way that they can live off of that. So if we look actually at the last bullet point, I think this goes along very well with the part-time options. Not having non-complete clauses in your contract. So making sure that you don't have that for the mental health providers, allowing them the opportunity to have a private practice along the work that they do at your health center. That makes a huge, huge, huge difference for people, because not having that opportunity, many of them will say, okay, I'm just going to go private practice, not take insurance, and much better off in that situation. But for many of them, they want to do that mission-driven work. So just going through these kind of quickly, being wellness focused in your organizational culture, leadership opportunities, continuing education. If you can support student loan repayment, definitely do it. You know, think about how the people who work in your health center talk about mental health and substance use. If you work in a culture that speaks about it in a very stigmatized way, you're probably not going to be able to retain your mental health providers. Offering them the same support as all of the other departments. And again, understanding their role is so critically important, because for a long, long time, they were just kind of pushed off to the side. So ensuring that people don't feel that way is a way to keep them in the organization. So I know that was a lot of information. We have 5 minutes left, so I did want to open it up if there were any questions. So please go ahead and put your questions in the chat. As people are thinking of questions, I do want to just note 2 things. So we are doing a workforce symposium and also a workforce workshop in Nashville. So April 29th and 30th, and then May 1st and 2nd. We would love for all of you to join us. We go deeper into all of these topics, but especially how do you put people first in your organization? And then for the workshop is, you know, how do you build out that comprehensive workforce plan, which are fundamentally important for your mental health workforce. I'm not seeing any questions. So I'm also happy to let everybody go a little, you know, just a minute or 2 early, but just want to let you know, when you get the slides, we also made sure to put in a bunch of resources. We have self-paced courses, just link everything so it can be very easy for you if you want to go back and look at any of these. We also have an upcoming training on February 28th, 29th. It's around using art and creativity for well-being, our newsletter, and you can stay in touch with us. The one thing I am going to ask, Mariah will be pulling up an evaluation. So right before I let everyone go, if you could please just respond to this, be very, very grateful. And I do want to check one more time. Yeah, I don't see anything in the chat. And of course, if you have any questions, like you can, my personal email is in one of the first slides, but also the info@chcworkforce.org. You can reach me there. And I know we have 4 minutes, so I think Mariah will probably keep the room open so people can fill out the evaluation. But I just want to say thank you so much to everyone. Oh, and thank you, Meta. And I'm so sorry if I had mispronounced your name. And that's wonderful. Yeah, that you have been promoting to hire a team of mental health staff. Yeah, it can be so valuable. There was a health center actually that their like hiring committee, the people who do all their hiring, they always make sure to have their behavioral health director in that group because of the person's training around like verbal, nonverbal communication, asking questions, creating a dialogue with people. And they have found it really helpful to have that person in their interviewing process. So thank you so much. Oh, perfect. Okay. I always like to pronounce names correctly. So thank you. And again, just thank you, everybody. And I hope you all have a really wonderful day.